Hello, we are Team 1, and we did our project on ophthalmic implants for macular degeneration. My name is Matthew Casterly.
I'm Zach Siders.
And I'm Allison Smith. Age-related macular degeneration, or AMD, affects 11 million people in the United States and approximately 170 million people globally. These people suffer from various stages and types of this disease. Macular degeneration is a disease that impairs and reduces a person's central line of vision by fluid or blood leaking into the macula. This leakage occurs due to the pressure buildup in the blood vessels behind the eye. AMD impacts a person by causing blurriness, cloudiness, difficulty adapting to light, and straight lines looking wavy. A depiction of what a person with AMD can potentially see is shown on the right. This is what would be seen when there is leakage into the macula. These impairments affect day-to-day activities and ultimately a person's quality of life. Studies have reported that AMD corresponds to an increased risk of depression diagnosis in its patients. Our proposed product is important for preserving an individual's central vision and eliminating visual impairments of AMD.
So our solution to AMD is a single surgery scaffold implant that has two key functions. First is it releases anti-VEGFs or anti-growth factors. And the second is that it releases photoreceptor adhesion factors as well. And so respectively, what these two functions accomplish is the first one halts blood vessels expansion and swelling, and the second one prevents photoreceptor death. So photoreceptors die when they are detached from the retinal neuroepithelium, and so the extra adhesion factors keeps them alive and functional. Steady release of an anti-growth factor such as ranibizumab stops blood vessels from swelling and obstructing vision. So the two images on the right, you can see on the top the area of the eye tissue where our device would be implanted, and on the bottom right you can see a early mock-up of what we want the scaffold to be. So the obvious value of our product is that it prevents further vision loss in patients and actively improves their vision as well. It is also a one-time operation without the need for any follow-up surgeries or procedures. As far as costs go, it is an invasive procedure to get the scaffold implanted, and typical eye treatment prices range from around $2,000 to $4,000 on the market today. However, we hope that since it's a single surgery, and so because it is a single surgery and they won't have to get any follow-up procedures, that this will keep the cost down and insurance can cover most of the payment for the patient.
So our team researched at least two existing solutions that help treat AMD, one being intravitreal injections, also known as anti-VEGF drugs, which doctors inject into patients. And the second being photodynamic therapy, which is just a combination between an injection and laser treatments. These treatments are pretty much just some solutions that our team wants to improve on. So this is why these would be considered competitors for our design. And aside from this, our solution is preferable because essentially there's no cure for AMD. And we want to be able to come up with a product/device that is implanted into the eye, which cures blood leakage and prevents dissociation of photoreceptors, like Zach said. And in addition to this, we want our potential solution to be long-lasting, since the other two treatments we mentioned only last for no more than 2 months. And in terms of issues that may arise if our device is unimplantable, would simply be the continuation of symptoms from AMD, so vision loss, blood vessel growth, etc. And in terms of our target audience, we want to make sure we choose the right people who would invest in our product implant. And some of these people would include eye specialists, eye care centers, etc. And most importantly, WPI and possibly the BME department, since they're the people we're actually presenting our design to. And of course, our clients would be individuals affected with AMD. Here are our references. And that's all. Thank you.